All right, so what we have here is one example of an integration into an EHR where in the problem list itself, as we know, there are rules around HCCs. They must be addressed within a calendar year in order for them to continue to be considered valid diagnoses. Part of IMO's workflow around the problem list management has to do not only with creating clinically relevant categories such as advanced directives and coags and thromboembolic problems, as opposed to just a body system sort. You'll see there is a tab there that is an HCC list. We'll get to that in a moment. And what it allows you to do is very quickly, and you'll see right now we have V24/8 still indicated there. Eventually that will go away and you will end up with just the V28 and eventually hopefully not needing an indication at all when there's only one version. But we show you the differences between orange, which means it has not yet been addressed in this calendar year, versus blue. Now, blue can mean two things. Blue can mean that it's been addressed, or in this situation, like on the left, where the diabetes is blue, it's because there is another diabetes diagnosis right below it, which has a different HCC category, one that gives you a higher RAF score. By definition, we didn't assign that. It's just that's the patient diagnosis. So the appropriate HCC category would be that more acute one or more chronically ill HCC than just the generic diabetes, which does carry a RAF score, but at a lower one than that second diabetes, type 2 diabetes with diabetic neuropathy, than that would contain. So this is part of the way that we affect the workflow. We bring it right into the clinician's wheelhouse. Whether it's a hard step or not is really up to the institution themselves on how they deal with these alerts, but we do provide that, that indicator that there are these diagnoses that do need to be addressed.